And thank you very much, everyone, for attending today's presentation brought to you by Premier, representing for CarePartners this year. And we truly appreciate the opportunity for them to help support us in this endeavor. I'm on the calling you from my mobile office here. I'm actually in Marlborough, Connecticut right now. Jesse Mejia, who is our head of sales, is also on the call, and he is up in Canton, Massachusetts today. So we're very mobile, but actually I think I'm an influencer on my Waze app. So if anyone needs any directions or advice with commuting around the state, I'd be more than happy to share it with you. CarePartners has done an incredible job this year. I've been with the company since the beginning and really feel that we have come so far from where we were 5 years ago. And we're entering our 6th AEP, and our organization has put in, a ton of effort and support to get us to this level. Between investment in the network first and foremost, but the product itself and the strategy behind our product, and then most importantly the support of the brokers, and finally getting the parent company to realize and recognize that the broker model here in Connecticut is clearly the path to success. So with that, if you could, Sarah, go to the next slide. So CarePartners of Connecticut is an organization that we have, like I said, down here in Connecticut, been on the forefront of our overall parent company, Point 32 Health, in driving the idea that broker is the direction to go to be able to populate this and grow our organization to really where we feel like it needs to get to. We feel that this year is going to be a huge step off point. And so the slide deck starts off with the most important thing, I believe, and that's compensating the brokers. We'll show you how that we put together the network and the plan to support this, but we really feel that this is going to be something to help you motivate, maybe to have a conversation with that client who is with a plan. They've been with a plan for a couple of years, but deep down that it's probably not the best plan for them to be in, but they've been happy year after year, so it's kind of rolled over. I think we're getting the attention now that it's going to be required for you to at least mention to them that you certify with CarePartners, and that you would be remiss for not talking to them about us. Our top tier Medicare broker program runs from January 1 effective dates through 4/1 effective dates. So all of your AEP business and all of the OEP business, or any new business that you write between January 1st and April 1st, count towards this program. So if you're looking at 5 applications, that's very doable by everyone here that's on this call. That would get you our bronze level. And the bronze level of the program will award you $100 per application of co-op money, as well as opportunities to be able to see what it is that we are doing differently in the state and how we're aligned with providers. 20 applications will get you to $150 per application, and that goes back to application number 1, of course, because that's the right way to do it. And then 30 applications will get you $200 per application. And again, it goes back to application number 1, and then there's no cap on that as well. Sarah, on the next slide, if you could, you'll see an illustration here of what that really could look like. And this is in addition to, obviously, the street level that is already being given and took a bump up again this year. So this on top of that, plus the HRA that we'll talk about, so that you're not missing out on that opportunity, really equates to a fantastic opportunity for the broker. And really the reason that Premier is promoting us. They feel that this is a great chance for you to be able to grab onto this and jump onto a program that is really offering a fabulous plan for our members. Does anyone have any questions? I'll keep an eye out on the chat box there. Please don't hesitate to just raise your hand or be interactive. More than happy to go sidetrack if we need to answer anything or provide further explanation. But I think this pretty much says it all. Network is the most important thing after this. So when we look at network, and you'll see on the next slide how we've doubled in size from last year. This time last year, we weren't talking about Yale, we weren't talking about Pro Health. We didn't have those in our network. Now we do. And then this past August, we also added Bristol Hospital. So between those three and the providers that have been included with that, along with the efforts that we've been doing all along to expand our network, we've doubled in size. So we're still not in Fairfield County yet, but we are with our network. So as you look through the list here, you'll see that, you know, there are hospitals, obviously, and providers that exist in Fairfield County. So we intend to be there, hopefully in 25, but we've got the infrastructure there in building it out, and we'll get to that point. But what that means is it's support for that Lower New Haven member. When you're looking at our plan, because we don't have the western side of Litchfield County, you're really looking at Danbury, you're looking at Derby, Griffin Hospital, all the way up Route 8 through Litchfield County to Winstead, and then east. We don't have the Nuvance system, so we don't have the western side of Litchfield County, but in terms of popularity and population, the majority of the state is certainly being covered by us. And with the addition of Yale, the whole 95 corridor from Greenwich Hospital up to Bridgeport Hospital, and then into New Haven, and then all the way out to New London and actually into Westerly, Rhode Island. So where we were competitive along that 95 corridor before, now we are incredibly strong. CarePartners is a joint venture with Hartford Healthcare, and that was the nucleus of our network for the past years. But we felt that we were finally able to get our plan and our program to a point where we were able to include Yale and have them be participating with us. So you know, we feel that right now we're in a fantastic position to really just blow this up. So next slide, you'll see that we do have that expansion and really just doubled in size and not sitting on our laurels, but continue to grow. I love the fact that we added Bristol Hospital. So Yale and Pro Health were added last year, right around Thanksgiving time. So they didn't have a huge impact on AEP, but we have seen a massive increase since them joining with our production. And a lot of that is coming from the broker channel as well. So we're seeing a higher percentage from the broker channel, which is fabulous. But then the consistency and the momentum kept going by adding Bristol Hospital on, and then we continue to add providers throughout the state as we move along. So we really feel that network, which had always been a big drawback for us, right, creating us as that boutique firm, we now really see ourselves as a player in the state. So the plan is the other piece of it, right? We've got the compensation for the brokers, we've got the network for the members, and now we need to put together a plan. And so the majority of our effort has been focused on the PPO plan. And we did this for a couple of reasons. We've got about 5,500 members in our plan today. Almost 90% of those are on our HMO product. We've had excellent retention rates, but it's a product that has always been promoted from within and from the provider community. And now that we have got the brokers coming on board and also really recognizing us as a great option, we wanted to keep that sustainability, and we wanted to make it in such a way that we didn't alter or change the path of that HMO plan because of so many of our members. But in doing so, we wanted to focus on the PPO. Our plan currently has a $1,000 deductible on it, and we realize that that's not the gold standard anymore. Now we've removed the deductible on our PPO plan. It's still zero premium. Unfortunately, we did have to move the maximum out of pocket up, and that's going to be 63.50. But it is still competitive. But we felt that it was a good trade-off. Coming with an HMO, you realize that the network and structure makes a lot of sense. And just the opposite on a PPO, you want that flexibility and the opportunity to go wherever I want. Um, we understand that the majority of the people that use a PPO are still in network anyways, and typically are using it as an HMO, but they want that understanding that they can go where they want and see who they want. And we did this within the dental product as well. So we removed the dental product from the current plan. We are making this something that's we feel is incredibly attractive. So this is a $1,200 Visa card, and this is a dental product. So it's for your preventive and your services, anything except cosmetic. But it's a $1,200 Visa card, which means that it's 100% coverage from dollar one and from day one. There's no waiting periods, there's no network, no restrictions. It's just the ability for someone to go to a dentist wherever they want and swipe that card. They could negotiate with that dentist and say, hey, look, you're getting paid today, and not have to worry about, balance billing, obviously, if it's under the $1,200. But it's that $100 per 100% coverage from day one, which is really fantastic. So if you're using this card for major services, if you want to think about it, it's like having a $2,400 benefit because it's covering it at 100%. So if you had a $2,400 benefit that was 50/50, and maybe with a deductible, that would be what you'd be looking at. But here, with the $1,200, it's 100% coverage from right up front, and we really feel that this is something that's been very, very well received, and we are really proud of this. And on the PPO side, what we've done is we've created it so that it's just still one card for the member. So they'll have their ID card for the medical side, and then they'll have this secondary card for the dental. But we've also included it to have and house the over-the-counter benefits. So they continue to get $65 per quarter. It does not roll over on that. We are using OTC Nation. And on the OTC, they've got the ability to, again, access that wherever they want. They can do it over the phone, they can do it online, they can do it off of the catalog, or they can go to the retail store and actually download an app from the App Store that would allow them to scan items while they're at the store to see if those things are covered under the benefit, and then just swipe that card at the counter and go. So we really think that this is an excellent option for folks, but yet it's simple enough that it's just dental and it's not complicated, that it covers in all these different areas. We wanted to keep things simple, and that's really one of our mantras, is to keep it simple. I mean, we only offer 2 plans. Hopefully in the future, when we have a DSNP, we'll again keep that simple, but we really feel that this is just a nice, refreshing way to look at the market. And this is a kind of an evolution of where we are today and where we're headed. Like I said, on the HMO side, we wanted to keep that as stable as possible. And instead of creating a new plan, we enhanced the existing one. Like I said, we have a lot of membership in that plan, so we didn't want to disrupt it, or we didn't want to create a plan that is going to cause you the need or feeling that you need to transition that member from one internal plan to another. We recognize that there's no earning of money for a broker when they move it like that, and so we go in a different direction, in that we are enhancing the plan that we have and making sure that that member is really being rewarded. So if you look down below on the left, our current benefit is a $1,500 maximum, which was very nice. It is a PPO plan, and so it does allow that member to go in and out of network. We use Dominion, but it had a $100 deductible. It covered it 100% for your basic services. I'm sorry, for your preventive services. And then you had that $100 deductible for any basic or major services. So now we've blown it up completely and we doubled the benefit up to $3,000 now. And then we kept it with a PPO product, so they've got the flexibility to go in and out. We removed the deductible altogether, and then we increased the co-insurance from 150/50 to 180/50, and now we're also going to be including implants and fluoride. So, we really think that our members are going to be absolutely thrilled with this benefit, and we really believe that this is going to be something that obviously would not only help us on the retention side, but to continue to grow. There's other plans out there that have an optional rider that you can pay to get a plan that's kind of structured in this manner when you're getting it at no cost under our plan. So we really feel that this is going to be something that will help to support our growth. And then the PPO side, like we said, we ditched the dental altogether and just wanted to give the Visa card for that added flexibility. So this is a little further breakdown of our product benefit summary. And I think everyone yesterday got an email from me with our ANOC letters that are going out to the members that are obviously existing, as well as our electronic version of our enrollment kit. So there you'll see a full summary of benefits that's there. So if you do want to make sure to check to see that you got that email from me yesterday. But again, when you're looking at this HMO product, it's got a $4,900 maximum out of pocket. And so it's an incredible value and a financial protection that's provided to those members. I often talk to brokers, we don't have a D-SNP product, no, but we've also seen a lot of people going through redetermination over the past year. And a lot of them are losing their QMB status, and maybe they're falling into the ALMB or SLMB. And when you consider that, while they're getting the assistance on the drug, they're not getting the assistance on the medical. And having that financial protection is super important for them. So that $4,900 is something that we've maintained now for 4 years and are proud to continue doing so. No change to the PCP and specialist visit. We did alter the inpatient hospital, but we think it's for the better because it went from days 1 through 4 at $475 to days 1 through 5 at $395. So it's an $80 savings on copay, and the average length of stay at the hospital is really about 2.5 days. So we still, again, feel that this is a savings for the member. Our prescription plan, which I'll go into greater detail, did not change. It does not have any co-insurance on the lower tiers. We do have a 33% on tier 5, but for tiers 1, 2, 3, and 4, it's a copay, just as it always has been, and hopefully will continue to do so. We recognize that that's a challenge when you're doing evaluations for your clients in the fall, and then literally a year later they're still using that plan when they've gone into the donut hole, and having those co-insurances can certainly be something that's very difficult to estimate for them, especially because of the changes that happened in the drugs over the course of the year. So keeping that static was really important to us. In fact, we enhanced it in a couple of ways, but I'll get into that more. But we only have one drug plan, so it's just simple. We have one drug plan between the HMO and the PPO. It's the same formulary, so it's just simplicity. And then, of course, we already talked about the dental. A couple of nice things that are also included on the HMO that are not on the PPO plan is the wellness allowance and a $150 weight management allowance. So the $150 weight management allowance would pay someone for the program fees for like a Jenny Craig or a hospital-based or a Weight Watchers. The wellness allowance, which is $175, which is what it is today. So anybody that has members on our plan today, make sure that they are using that before it goes and gets reset for next year. But that can buy someone a Fitbit, or pay for gym membership or Pilates classes, or any type of activities in the evidence of coverage. It's a much more explicit list of things that do cover for that, but it's certainly a great add-on. Again, that's only on the HMO product. When we look at the PPO, again, as I said, we got rid of that deductible, which was just massive. There's where you see the increase in the max out of pocket to help cover the cost for that. But again, 0 and 45 for the PCP and specialists. But I want to point out that we do allow for just a copay out of network. So when that doctor is being seen and they're out of network, we can still have that covered with a copay. So it's $50 for your PCP. It's $65 for the specialist. So it's a $20 bump, but it does give them the flexibility to be able to go to those doctors out of network without having to get into that co-insurance structure. We kept the outpatient hospital the same as we did on the HMO. Currently, that's an administrative cost, so it's $795, I believe, as an admin cost plus the deductible. So you're really looking at almost $1,800 today, and as opposed to going into the hospital next year on the PPO and you're looking at $395. So it's a big difference if it's a one-day visit. Again, RX is the same, and we discussed obviously the dental eye exams. We use iMed. I'm going to make sure that everyone, I believe I sent it out already, but I'll resend it, is the quick reference guide. And that is a document. It's a two-sided page that has details about our vendors and services that we use and the networks that are used within that, list of doctors and prescription coverage. So it's just a really helpful piece, something that was designed to have in your briefcase as you pull out when you're talking to a client. I always said that I wanted to have it be able to answer 85% of the questions that you would have if you were to sit down cold in front of a client and not have any past experience with CarePartners. You'd be able to work your way through that. Then we look at the OTC between the two. Currently, the OTC on the HMO is $50, so we've increased that by 17, bringing that up to $67. And we're keeping it at $65 on the PPO plan. So again, the flexibility that that member has to go wherever they want, we have built into the plan. So the pharmacy, we do use OptumRx as our pharmaceutical vendor. This will be the second year that we're using them, and we are thrilled that we're now including Costco into the mix. We did not have Costco under our benefit before, and we have now included that, but also Wegmans. So for anyone that's down in the Fairfield County area, they have broken ground, and they are going to be building in Norwalk, their first location here in Connecticut. So kind of say it's a little foreshadowing as to where we are going to be in the future. One of the things that I love about this plan and have fought for is the coverage. Obviously, for our vaccinations has always been 0, which is great, and I recognize that that's more of a standard now because of CMS. But we also have full coverage through the gap on our Tier 6 products, so we really feel that that's a big plus. But it's the cost savings when we look at membership, right? So when you're talking to your members and they're utilizing mail order, we allow a 90-day supply for just 2 copays. So no one else is doing that. So I know the most popular plan out there has a same tier 4 as we do at $100. When you do mail order under that plan, you save $10. Your member saves only $10 doing mail order. It's $290 instead of our plan, which would be $200. So you multiply that 4 times a year, and you do that for other medications that they may be on, and you're looking at significant savings. So, I want to make sure that you're able to see us. I know that now that we're on Connecture, which was one of those hurdles that were in front of us last year. Now you don't have to uncheck that box. You have full access to Connecture and the ability to enroll plans through that system with us. So we think that that too is a huge benefit for you as the broker. But if you think about it, if you weren't unchecking that box, you weren't even seeing the results of Care Partners. You didn't even know how good we actually were coming up. So we really feel that that's going to be something that's going to help propel us as well. But the other piece to it that we've added for this year is that so Medicare has these excluded drugs. And so Medicare says for all of the private Part D plans that they have to cover so many drugs within each category. Well, one of those categories is drugs that you don't have to cover. And while we're not covering them all, we are covering a number of them. One of those being erectile dysfunction. So that'll be a zero cost on our plan, the preferred pharmacies, as well as vitamins and minerals. So I did check that the B12 shot is going to be something that we're going to cover at no cost on our plan. So I think that that's certainly something that's of great benefit. I know it's something I do for my father-in-law every month, and he does not have his covered. So that's the type of thing that is just helpful. It's those little things that the surprises is always what I've said, is to try to minimize those. But I think that this is fabulous in our ability to be able to offer this to the members. And this just goes to show the coverage that we have, and this has been our prescription drug plan for a number of years now. We recognize that you don't mess with it. You don't want to change things. It's about that stability. It's about the ability to put someone on a plan, keep that member happy on that plan, and have them renew on that plan, and not go up and down through the cycles of we need membership, we need to make it profitable. We need membership, we need to make it profitable. Or the other carriers that are adding a new plan and adding another new plan, and you're just migrating your business throughout there. It's all work for you. Our directive is to keep that member happy and allow you the ability to renew them simply and look forward at growing your business. I mean, that's my ultimate goal, is to help you grow your book of business. And I know Care Partners will get its share out of that growth. I don't expect it all. It's unrealistic. But if I'm able to help you grow your book of business and provide you with a simple plan that's got a great network and fabulous benefits and compensation to boot, then that's where we're headed. So the health risk assessment was, of course, another hurdle that we were not fulfilling last year. And so when we did grow and we had membership that was being added on, it was at the loss to the broker because they were not getting HRA reimbursement. So we've fixed that, and that is now functional. So if you're writing business with us today, please make sure that you are accessing that, and we do it a couple different ways. Connecture obviously is one of those. So when you log on to Connecture and you do an enrollment through there, it'll prompt you to the next step to be able to see if you want to do the HRA piece of it. Our assessment is 40 questions, so it is a little long, but that's why we make that at $100. And we also wanted to make sure that, if you're somebody that doesn't use Connecture or couldn't use it for an enrollment, that you weren't missing out on that. So we've also created a fillable PDF so that you can either print that out and do it literally on paper, or if you wanted to fill it out as a fillable PDF and then email it to us, you've got 7 days to get that completed, either through the other methods, and you get the $100 HRA with the commission on the plan. And again, commissions are paid out at the end of the month of the effective date for that member. We pay 100% of that upfront. I should say that any new to Care Partners business gets paid at 100% of the street level amount. The renewal is what happens when you are renewed, and then it is paid out on a monthly basis. So reasons to sell Care Partners. I think we've certainly addressed quite a few of them, but to just kind of recap is just simplicity. We make an easy plan. It's easy for the broker. It's easy for the member. We give the ability for a provider, and what we've done is give them the autonomy to make decisions. This plan, as I said, was created with Hartford Healthcare, and we did it because they were looking for a plan that provided them with the flexibility and the ability to be able to have them make the decisions. On our HMO product, we actually let the primary care physician provide a referral to an out-of-network doctor. And so this is something we've been doing for years. And we did it primarily because we recognized that there were the network that we had was not as robust as what all the others were, and that we needed to have that additional flexibility. But it goes beyond that now. Obviously, our network has grown, and we don't require the need to go out of network as much, but we still give that ability to the doctor to make those decisions. And if you think about it from the perspective of, if my HMO member wants to see a psychiatrist or a dermatologist or a podiatrist, these are things and fields that are very difficult to have robust networks of. So having that additional flexibility and really just the respect to give to the doctor to say, make the decision that you feel is best for your client, and we're going to process that. We're not even evaluating it on the back end. So we really feel that that's just a great added benefit and just additional flexibility for your member. The new PPO plan certainly is something that we really feel is going to be resonate with members, folks that want that flexibility, and have that built into the plan. The growth of the network is huge as well. So I think the next couple of slides, which I'll go through, is really how to access our broker portal, and it is yet another option for you to be able to do enrollments. So if you're not someone that uses Connecture, I'll take you through some of the steps to show you how to do enrollments on our broker portal, which is super easy. But if you could, Sarah, there's a couple of slides I think that you'll blow through here to get to the portal. We can obviously share the deck with everybody so they have that. And I think it's 2 more now. And then you can kind of go past this one as well. So as we look through this, the green arrow obviously is carepartnersct.com. This is our public-facing website, and where you're going to access and be able to find an incredible wealth of information. You've got your doctor search there, your drug search, your dental search, forms. This is for anything that's filled out, whether that be reimbursement form on there. We actually have, so if anyone has membership on our plan right now, you go to the forms section, and there is a reimbursement that your member can get for $50 if they had a wellness visit this year. So as you're reviewing their plan for next year, make sure you remember that and the wellness allowance, and make sure that they use those things before they reset for next year. So again, we think that it's so important to have those services done that we are actually reimbursing members to go do that. You've got your documents. Documents are just that. It's your summary of benefits, your evidence of coverage, the PDFs of the formulary or the directory is all findable, can all be found in that document page. But we're looking at the broker portal here. So it's that far tab on the right. You would click on that. You then have the ability to log into the broker portal, and you click on that lower box. So next page. Everyone has a user ID. There are people that have migrated from other FMOs to now be part of Premier. So everyone that is on Premier, you should have a username that is PREM and then either 3 or 4 digits, numbers after that. So if anyone is not using something that looks like that, please reach out to me so that we can get that resolved. But Otherwise, you're using your PREM with the numbers. You can request a password reset, or if you forgot your username, it is associated with the email that we have in the system. So if you've evolved your email over time and are having difficulty extracting that, again, just reach out to myself or our broker support to have that updated, and then make sure that we get you logged in. This is the landing page. So as you enter into this, you'll have the ability to make some decisions about where you want to go. If it's an enrollment, you click on the enroll now. But you've got essentially 4 tabs along the top. Enrollment and applications. You've got certifications and license, and you've got training and materials. Enrollments and applications are just that. It's where you would see your ability to do enrollments and any enrollments that you did through the system. We do not have a collective book of business report for you yet that you can access, but we can certainly manually get that by just asking. Certifications and license, this is where you would go to check for your ready to sell status, and training and materials is where you would go to be able to request those materials for next year. So this is the enrollment and application section. And so as this example shows here, that you now see the member, their effective date of the plan, when that application was received. It shows the member's name and their Medicare ID number, their birthday, address, all kinds of great information. When you see it says completed, that means enrolled. Otherwise, it would say submitted if it was that, or if it was pending, you would see pending. And they use completed instead of enrolled, but so be it. The other way, if you're not using the broker portal itself, you're also, everyone is given this PURL, a personalized URL. And you can share that in an email to a client. And what that is, it's actually a self-directed enrollment. So that member clicks on that page, and I'll show you what it would look like as they land on that. But what ultimately it does is it allows that member to go through and just as they would fill out a paper application, but it ties you in as the broker of record on that case. And they're not looking for scope of appointment. They're not looking for recording because, again, that's a self-directed enrollment. So just keep that in mind, please. Under the certifications tab, you've got a couple different options there: agent license, certification, agency license, and then ready to sell. And I think those are all pretty self-explanatory. So please, everyone, try to log on to your broker portal and check to see if, in fact, you've got the ready to sell status. If it's not, just send an email to broker support or myself so that we can get that rectified for you. Often it's something very simple. Here's under the training and materials. So if I wanted to order those new kits, I saw that I'm ready to sell and I need to order. I go to the training materials, and then on the top side there, you see where it says libraries. It also says enrollment kits, and it also says training. So those are 3 different tabs. If you were to click on the enrollment kit tab, where you'll see lower in the green boxes what you get, and then you can request enrollment kits, and you'll have the option if it's the current year to be between 23 and it, like I said, if you're ready to sell for 24, you'll have that there as well.
So this is what the scope of appointment looks like. It's pretty standard. Everything that you guys are accustomed to, it's available on the broker portal. It's pretty simple to follow. Yeah, you just log on and fill out the necessary boxes that we have as required, and then you go to the enrollment form. Next slide. So obviously, we start with the zip code. We select the plan, and you do the enrollment. You select if it's HMO or PPO, and then you get the necessary details from your member. And of course, we need to have their Medicare card available so you can put in their Medicare number, their Part A start date, and their Part B start date. This is pretty intuitive. I'm confident that many of you are familiar with this process, but it's pretty simple once you get to our portal. So once you get through everything, then we have the effective date of the plan. You select the primary care provider, obviously the location, and then select if there's any SEP, any special enrollment period that's required. So in this case, the example that we have is that I'm just new to Medicare. and then you just hit the date on when you're submitting, and then you hit next. So we have a few important questions that you will see. And so it's pretty simple and detailed. Very little that you need to type. So you just click on the buttons that are applicable, and then you just keep on going. If you ever get stuck with anything, then David Pilata is known to return calls quickly. So that is a benefit that we have, that we're a small team, but we are an extremely agile team, and we're capable of resolving any concerns that you have in a short amount of time.
That's all, actually.
Excellent. Excellent.
Yeah.
Well, listen, everyone, our sincere apologies that Dave was having some small technical difficulties, but the first part of the presentation, we're passionate about this product. We believe in it, and we believe that this plan, our HMO and PPO plan, will be an incredible addition to your portfolio as you help your clients and think about what's best for their needs for the upcoming year. And I want to give an enormous thank you to our friend Sarah and our friends at Premier for providing us the opportunity to share this content with you.
Yes, thank you all for joining. I really appreciate it. If you have any questions, feel free to call me or send me an email, and I'll be happy to help. We're excited about this with the marketing incentive bonus as well. That is above and beyond, and I think that agents are really gonna gravitate toward that, and the simplicity of your plans as well. You guys did yourselves a huge favor last AEP with the network expansion, your dental. So yeah, a lot to be excited about presenting this AEP with your product.
Great. Thank you, everyone. Have a great day and a successful AEP.